Are there genetic causes of sensorineural hearing loss? Have you ever wondered if genetics can play a role in hearing loss? The answer is yes. Sensorineural hearing loss can indeed have genetic causes. This type of hearing loss occurs due to damage or dysfunction in the inner ear, known as the cochlea, or in the auditory nerve pathways that send signals to the brain. Genetic mutations can disrupt the structures or proteins necessary for hearing, leading to either congenital hearing loss present at birth or progressive hearing loss that develops over time. One key aspect of genetic sensorineural hearing loss is the role of specific genetic mutations. Many cases arise from changes in genes that are responsible for producing proteins essential for the inner ear's function. For instance, mutations in the AUTOF gene can lead to a form of congenital deafness. The protein produced by this gene, called otoferlin, is crucial for transmitting sound signals from the inner ear to the brain. If otoferlin is not functioning properly, the ear may detect sound but cannot communicate it effectively, resulting in severe or total hearing loss from birth. The inheritance patterns of genetic sensorineural hearing loss can vary. It can be autosomal recessive, which is the most common in congenital cases, or it can be autosomal dominant. There are also cases of X-linked or mitochondrial inheritance. For example, Waardenburg syndrome, a genetic disorder linked to sensorineural hearing loss, involves mutations in several genes, including PAX3 and MITF, which affect both pigmentation and inner ear development. Exciting advancements in gene therapy are also on the horizon. Recent studies have shown that it may be possible to restore hearing in individuals with genetic sensorineural hearing loss. One innovative approach uses a harmless virus to deliver a healthy copy of the AUTOF gene directly into the cochlea. Clinical trials have indicated significant hearing improvements in children and young adults with AUTOF-related deafness after just one injection. It is important to note that sensorineural hearing loss is genetically diverse. This means that many different genes can be involved, making precise genetic diagnosis essential for personalized treatment and counseling. Genetic testing plays a crucial role in identifying the underlying cause of sensorineural hearing loss, especially in cases that arise at birth or in early childhood. Understanding the genetic basis of hearing loss can help guide treatment decisions, including whether a patient may benefit from emerging gene therapies. Early diagnosis and intervention are vital, particularly for children, as they can lead to better outcomes in hearing restoration and language development support. Genetic counseling is also important for families to understand the inheritance patterns and the risks of recurrence in future generations. In conclusion, genetic causes are a significant and well-established factor in sensorineural hearing loss. Ongoing research and clinical advancements continue to offer hope for effective treatments through gene therapy. If you or someone you know is experiencing hearing loss, it is essential to seek evaluation from healthcare professionals who specialize in audiology and genetics for accurate diagnosis and management.